Yes, so then I'll be going through some of the vector control tools that are recommended for controlling of malaria. And then I'm going to be introducing a new platform called MAGICapp. It's a software tool where these interventions that are recommended and other recommendations for malaria more globally will be published in the next few weeks. Okay, so first of all, just some definitions. Sometimes it can be a little bit confusing as to what all these different types of documents that come out of WHO actually refer to. And so first of all, a guideline is any document that's developed by WHO that contains recommendations for clinical practice or public health policy. Within these guidelines are a series of recommendations, and these recommendations are particular actions or different interventions that could be rolled out by a country that are recommended by WHO. And these recommendations are made based on systematically reviewing the available evidence. So the recommendations are only good as the evidence that is available. So as Rahman mentioned, if the evidence is very limited, it's very difficult to come out with a strong recommendation. Reviews are updated, and so these recommendations are not static, they can be living, such that when more evidence is generated, the reviews are updated and the recommendations can also be updated. Policies are decisions, plans and actions that are undertaken by member states and countries, and not what WHO devises. We just make the recommendations for particular policy decisions. And then guidance is a broader term that encompasses any type of advice, and it can be specific guidelines, but it also can be documents that are produced or good practice statements that are not necessarily based on a systematic review of the evidence. So for example, in terms of vector control, we have an operational manual for indoor residual spraying, which is currently being updated. This manual is actually going to be expanded to include IRS, not just for malaria vectors, but for other vectors of other disease as well. So first of all, how do we enter into a guideline? And we receive a number of inputs from member states and country officers and other stakeholders who might be asking WHO for advice on a particular strategy, interventions, what they can do in a certain situation. External experts also may provide some input. And within the malaria space, we have the Malaria Policy Advisory Group who look through all those different suggestions with the Global Malaria Program to then decide what are the key questions, what are the key areas for which a guideline needs to be developed. And there are several groups that are involved in developing WHO guidelines, and they all work together and are managed by the Guidelines Review Committee that Rahman referred to. This is an internal committee that assures that the development of the guidelines are conducted according to standard procedures, and that the product that comes out at the end, i.e. the guideline, also meets the expectations of WHO. When we're designing our initial proposal, that's a proposal as to what we plan to do with these guidelines. It's managed by a steering group that's an internal group within WHO that includes units from headquarters and from regional offices. And they will put together what are the key areas that need to be addressed for which we need recommendations, and who will be involved in actually assessing the evidence and finally giving peer review of the guideline that's produced. The main group that actually is going to look at the evidence that's been reviewed and formulates the recommendations of the guidelines development group. And these are non-WHO entities that are from all over the world. And they represent many different areas of expertise, which can be technical areas of expertise for that particular guideline, as well as end users and people who are from endemic countries. We then have the evidence review group, which is more commonly known as a systematic review group. So they will be gathering all the evidence and then systematically reviewing it and producing a systematic review that will then be reviewed by the Guidelines Development Group to come up with recommendations based on the strength of the evidence. Finally, as I mentioned, once the guidelines have been drafted, these pass for peer review to an external group of experts, and then these will go on for publication within WHO. So this is just a quick outline, sort of going through that again, where the guideline is initially scoped. The GDG will be forming the key questions, that's the Guidelines Development Group. The evidence will be reviewed and the certainty of the evidence graded, and I'll come on to that in a minute. The GDG then meet again to formulate recommendations. These pass for external review, and then WHO will be disseminating, implementing, and evaluating the impact of these guidelines. And one key person who helps through the whole process is somebody called a methodologist, just ensuring that throughout this process we're following the standard procedures. So key questions that form the basis of a recommendation are framed in a system called PICO, which refers to the population, intervention, comparator, and outcomes. And so you will see in a number of WHO guidelines that the recommendations are framed around this type of question. So the question is, in population X, is the intervention, whatever that be, that is being, the evidence is being reviewed for, versus the comparator, so that's your control group, is recommended to prevent or control or result in a particular outcome. And then that when we make the recommendation statement, this is then reversed. So for example, in malaria vector control, the recommendation may be in areas with ongoing malaria transmission, the panel recommends insecticide-treated nets compared to no nets to prevent malaria in adults and children. The evidence is then graded, and this is a common international grading system. Grade refers to grades of recommendation, assessment, development, and evaluation. It's a structured and transparent system that allows the reviewers to look at the body of evidence and determine the certainty. And it's graded as high, moderate, low, or very low. And then this results in the strength of a recommendation based on that evidence that can be strong, conditional, contingent, or discretionary. And in the malaria vector control guidelines, we either have strong or conditional recommendations. When the systematic review teams are grading the evidence, not only are they looking at the direction and strength of the certainty of the evidence in terms of whether the results across different studies are consistent, if there's bias, but they also should be looking at the balance of the benefits and harms for those who may receive the intervention, what people may like or prefer, and the acceptability, the feasibility of being able to deliver that intervention, how it may affect equity, and also the resource implications. So grade was first began, people who were working it first began considering this way of analyzing and assessing evidence in 2000. And in 2004, there was a publication in the British Medical Journal that actually describes the process. It's now been expanded to an international working group, and more than 110 organizations around the world are using GRADE. So moving on to the guidelines for malaria vector control. Starting in 2017 through to 2019, it was realized that a number of the different guidance documents and guidelines that have been published over the years need to be consolidated into a single standalone document for malaria vector control. And so in 2019, the guidelines were published. Some of this involved commissioning new systematic reviews for interventions for which there were no guidelines as yet, and others brought together guideline documents for particular interventions for which systematic reviews had already been completed. And this document combines not only those recommendations that are, those interventions that are recommended, but also some background information for those particular tools. It shows the evidence profiles that we use to assess the evidence for each recommendation, and also good practice statements. So as I say, good practice statements are practice that WHO recommends, but may not have necessarily undergone a systematic review. So I'll just go through the current malaria vector control recommendations. And first of all, starting with those interventions which are recommended. And rather than reading out the recommendation statement, as you can read those for yourself in the document, and you'll be sent the link to the vector control guidelines. The two major tools that are recommended for large-scale deployment are insecticide-treated nets, and that's recommended that are treated with insecticides that have been pre-qualified by WHO, and indoor residual spraying. And at the moment, we have a strong recommendation for pyrethroid-treated nets. And the reason is that the evidence for other nets is limited at the moment. Pyrethroid PBO nets, so these are nets that are treated with pyrethroid and also a synergist that has been designed to tackle pyrethroid resistance mosquitoes, has a conditional recommendation for use. The reason is at the time of reviewing this evidence, there were few studies that showed increased efficacy of these nets over pyrethroid treated nets. And at the time of the review, these pyrethroid PBO nets were considerably more expensive than the pyrethroid ITMs. So a conditional recommendation exists for the use of this, and these nets are recommended in areas where pyrethroid resistance is evident, so it's been confirmed. It's of an intermediate level, so it's not in intense resistance, and that it's conferred by a monooxygenase-based resistance mechanism, because the PBO is going to be tackling that resistance mechanism. Having said that, we are undergoing a review of new data that's available right now, and that systematic review should be available in the next few months. And we hope then to review this recommendation and see whether this needs to be updated at all. When considering these two main interventions, WHO recommends that priority is given to delivering either ITNs or IRS at high coverage and at a high standard, rather than introducing a second one because there's deficiencies in implementation of the first. The reason being is that both are quite, if you're going to be combining them, they're quite expensive. And data has shown that the combination of two from trials that have been carried out so far have mixed results. Some of them are showing that you have increased control, some of them you're showing that you have no added impact at all. And so the evidence for this is very weak. Again, we are revisiting this to see whether there are areas where layering the two on top of each other may result in greater impact against malaria. And some trials are being completed right now that would address that. The guidelines then go on to talk about supplementary interventions. And these are interventions that are recommended in particular areas where high coverage with either ITNs or IRS has been achieved. And the one intervention that is recommended for which there is some evidence to show efficacy is larviciding with biological or chemical insecticides. This is recommended in particular areas where aquatic habitats are limited, so they're not very expansive, they can be found, and that they're generally permanent in nature so that they can be revisited. When considering larviciding and layering this on top of ITNs and IRS, there needs to be some assessment as to whether this is going to be feasible and cost effective. So consideration of resources needs is a key consideration. This if you're going to be rolling out larviciding on top of other things. We have a number of good practice statements that follow on from these, and I've sort of alluded to these already, that populations are covered at a high level with ITNs or IRS, that if programs do choose to implement ITNs on top of IRS or the other way around, once high coverage with either one of those tools has been achieved, that this is really just used as a way to mitigate insecticide resistance. Reason being, as I said, that this could be a very expensive exercise deploying both. And then I've mentioned about recommended supplementary interventions may be layered on top of the ITNs or IRS in particular settings, but a prioritization analysis is required. Then there are some vector control interventions which are currently not recommended. And largely this is because the data to date doesn't have either strong evidence for control of malaria at the community level, or is in very particular groups and cannot be recommended for the general population. So topical repellents, an analysis, a systematic review was conducted, and the outcome that they were looking at was malaria at the community level when repellents were deployed to individuals. And they showed no impact in malaria outcomes at the community level, but did show individual protection against mosquito bites. We are revisiting this area to see whether there are other studies that have been conducted to look not just at the community level, but at individuals who did use the repellents, whether their malaria outcomes were more favorable. Insecticide-treated clothing has also been undergone a systematic review and did show some protection against malaria for individual groups, but not again at the community level. And so there's a conditional recommendation against the use of insecticide-treating clothing to be delivered to communities. And space spraying for malaria control was also systematically reviewed. Unfortunately, the studies that were available were all observational studies for which the evidence is generally graded as low. And there was also found that it was a bit debatable as to whether that actually improved malaria outcomes or not. And given the high cost of space spraying and the lack of residual effect, WHO recommended against the use of space spraying for malaria vector control. There was also some systematic reviews that were gathered for other interventions for which the body of evidence at the time was insufficient, such as larval habitat modification and manipulation, so environmental management, house modifications or improvements, spatial or airborne repellents, attractive toxic sugar baits, and larvivorous fish. There are a number of studies that are being conducted at the moment within these areas, and we look forward to those studies being completed and then the systematic reviews being conducted in the future. So following the publication of the vector control guidelines in 2019, the GDG at the time and also member states and others who gave feedback identified areas that still needed to be evolved and updated. I've alluded to some of those already. And so we are now working on updating those guidelines. And we had a guidelines development group meeting last year in November where a number of new topics were discussed and some systematic reviews were assessed and some recommendations are currently being drafted. The particular areas that we're looking at was some better descriptions of how ITNs work, the personal protection community elicited by ITNs. There's a systematic review that's been completed and was published by Cochrane last year on housing modifications for malaria control. As I mentioned, the systematic review on pyrethroid PBO nets is currently being updated. We're revisiting guidance on combining IRS and ITNs. A systematic review on larval habitat manipulation and modification was recently completed and should be published in the next few months. We've also commissioned a systematic review into vector control in complex emergencies, particularly for malaria. We are revisiting the evidence that's available for topical repellents. And one of the other things we'd like to include in the next set of guidelines that gets published is considerations around resources to help countries prioritize what interventions may be deployed and the packet of interventions that can be used against malaria. WHO also has been reviewing how guidance and guidelines are created and uptaken by countries, and identified that there were some areas that needed some improving. And this is just a list of some of what GMP, that's the Global Malaria Program, is doing to encourage the uptake and make dissemination of materials easier for end users. One of the areas that was identified was the naming and how GMP documents were structured. They're compiling all GMP guidelines into a single document for the guidelines for malaria. And I'll be going through a platform, as I mentioned, on MAGICapp of where that will be published. The website will be redesigned so it's easier to find documents. As I mentioned, we are ensuring that all the guidelines are developed in a consistent way and that this process is quality assured. I'll go on to MAGICapp in a minute. And then we're making increased efforts to engage WHO country and region staff in disseminating and uptake of the guidelines by member states. And we will be engaging all malaria partners in dissemination through reaching out to people directly and through webinars and being available for questions from anybody who has them. So I'd just like to finish by going through this software tool where we will now be publishing the malaria guidelines. And we're using an app called MAGICapp. MAGIC is a non-profit foundation. I think it was developed in the Netherlands. And it brings together all the guidelines that may be for a particular topic. It displays the evidence summaries. So those are outcomes tables from studies, the systematic review findings. It also has decision aids, so easy to download and print guides of how to deliver an intervention. And also a lot of background documentation on how the interventions work and associated guidance documents, as I said, like the indoor residual spray manual, so quick links to those. It's used both as a platform to develop guidelines and then to publish them, and it's very quick to update them in user-friendly format. The software is available for computers, tablets, and smartphones. So this is the website where the guidelines will be available.